Well, again, that's a question we have, asked to us all the time. This is the ultimate procedure designed for the anxious patient. When I was in dental school, I was lucky. I worked for a dentist who had a PhD, who was a behavioral psychologist, and he set up the first fear clinic in the United States at the University of Florida, and I was his assistant. And it would take him sometimes 2 months of therapy to get somebody to sit in a dental chair. So I understand dental anxiety. What's unique about the D5 is that it's basically, with the one version, it's up to little as 2 visits to do the procedure. You come in, we basically heavily sedate you to the point you don't remember the surgery being done. The anesthetic we use is designed to wear off rapidly so that when we do the digital records, which are actually like almost digital cameras that don't hurt at all, that takes about an hour to an hour and a half. And then for that first main visit, you're done. If you come back for the nanoceramic version, on the next day, we're going to come in and we're going to use a super numbing gel that was designed for Botox and fillers. We put this in your mouth for about 15 minutes with a little bit of nitrous oxide. And 90% of our patients, that's all we need because each restoration inserts in about 5 minutes. If you do our latest zirconia restoration, you're going to come back one visit where you're heavily sedated for the surgery. You're going to come back for the second day, have a beautiful mock-up of your new teeth inserted that you're going to go home with. We're going to perfect the bite, and just a few days later, you're going to come back and you're going to have beautiful permanent teeth. So if you've been anxious, and that's probably one of maybe the cause your teeth have went and not are in perfect shape, if you can give us no more than 1 week where we really take care to make sure you feel comfortable and we make sure you don't have discomfort, your problems are totally solved. As opposed to a teeth in the day center where if you're an anxious patient, just know you could take up to a couple visits to make the temporary restoration. You're going to come in and do the surgery and get temporary teeth. You're going to come back and have to have the implants uncovered with another surgery about 4 months later. And then you're going to spend up to 12 visits over 2 months to make the restoration. So if you're an anxious patient, that kind of procedure can really develop anxiety. With ours, just 2 to 3 visits, no more than a week, we've totally got your problem solved.